Welcome to everybody. It is a very big pleasure to be here with you today. So the session that we will start now, it's titled The Impact of IoT in Daily Life of Ischemic Cardiac Patients. And I have the big pleasure to introduce you to Dr. Maria Sanz de la Garza. She is a consultant in cardiology. She's working in the Institute of Cardiovascular Diseases in the Hospital Clínic of Barcelona. And she has a wide experience in cardiology and prevention, and she is member of the nucleus of the European Cardiovascular Prevention Association. So welcome, Maria. Thank you so much for your time. And also, this project has been powered by Ferrer. Ferrer, it's a pharma company based here in Spain, but also they are international, and they have also they are part from this digital project. And from the other side, I am Nuria, and I am the CEO and the co-founder of Humanity Care. Humanity Care is a digital health company working in the chronic care. And so you know that here we have a chat. You can put your questions, put any thing that you want to share with us, and in a live way, we will contact you, we will answer you, and we will be here for any doubt and question that you have. Thank you so much, and let's start. Working in an IoT platform. This IoT platform, what it aims, it's to collect real-time data from patients with cardiac diseases, and through the application, we can collect data from different wearables, and also this data can be sent and connected in a very precise way into the websites from the doctors. So thanks to this technology, in a real time, these doctors can see the data from patients out of this clinical setting, but most important, they can also do a telemedicine visits with also a group of telerehabilitation, and also they can have a chat and connect with also their nurses or physiotherapists. So this tool is the tool that we developed for this specific need, and we also gather different data that we will explain you later. And this is the base of the technology that we have developed together also with Ferrer group. So just to have you an idea of how it works, this Humanity Care platform can be personalized for the needs that the medical team has. So in that case, what we have provide to this project, it's first an application. Through the application, that patients can gather like different data from their health, but also, which is very important, to answer surveys about their health and also about the quality of life. And this data that they answer through the application, and it is collected through the application, it is also sent in a very easy way and also secure way to the dashboard of the medical team. And then they can see in a remote way the status of the patients, the tracking activity, also the heart rate, and also they can communicate with different channels through that platform. As you can see here, it's an example. So this is an example of the platform that we also personalize for this need. And now we will explain you in more detail the medical part.
Well, thank you so much, Nuria, for this kind presentation. We all know that physical training is one of the most effective therapies for cardiovascular patients, and it is indeed recommended with the highest level of evidence for patients with heart failure, patients after a cardiac surgery, and also for the improvement on conventional and non-conventional cardiovascular risk factors. In addition, there is growing evidence that exercise training could be also beneficial for patients that have been traditionally discouraged to be enrolled in physical activities, such as patients suffering from congenital heart disease, myocardiopathies, or heart transplant patients. In addition, innumerable studies have confirmed the very beneficial effect of exercise training for patients after ischemic heart disease event, which is the focus of our application. Exercise training, as said, is the key element of the cardiac rehabilitation, but not the only one. Cardiac rehabilitation could be defined as a set of methods that aim to return to the patient the maximum of the physical but also mental abilities, allowing them to recover a normal life from a social, familial, and professional point of view. We can consider three phases in cardiac rehabilitation program. The first phase could be the inpatient phase, which is after the cardiac event, and normally it is performed within the hospital. The second phase could be the outpatient phase. It occurs after the discharge of the patient from the hospital, and it's normally performed in a center adjacent to the hospital. And finally, the phase 3, which is the maintenance phase, and which is normally performed in the community. Assessed, complete cardiac rehabilitation should include not only the exercise intervention, but also the nutritional and psychological support. Indeed, international guidelines focused on ischemic heart disease patients, they not only recommend exercise training, but also a nutritional, psychological, and empowerment of the patient support. Present the results from the Euroaspire IV survey, which presents results from cardiac rehabilitation programs around Europe. Specifically, they included 78 European countries. 51% of patients were referred to a CR program. This referral was lower in women than in men. The adherence to the programs was high, 81%, and equivalent in both sexes. To perform a CR program was effective in reducing smoking consumption, also in reducing obesity. Also, they improved medical treatment adherence, and also they improved anxiety and depression symptoms. In practically all cardiac rehabilitation programs, they include exercise training and nutritional support, but only in 60% of them, they included educational material or stress modification and relaxation methods. Cardiac rehabilitation programs in ischemic heart disease patients, as I'm showing you in this meta-analysis from 2016, it's able to reduce cardiovascular mortality and hospitalization. But still, in the current era, 2020, with all the advances in medical therapies and also interventional therapies, cardiac rehabilitation has demonstrated to reduce mortality for any reason in ischemic heart disease patients, as it is shown in this meta-analysis from 2020. Here I present this study that includes more than 1,300 ischemic heart disease patients, in which they perform a cardiac rehabilitation program that combined aerobic and strength training and nutritional support. Cardiac rehabilitation was able to increase functional capacity in over 90% of the patients. This increase in functional capacity was greater in all the patients and lower in patients with diabetes, which indicates that there is a need for individualization of cardiac rehabilitation programs. In this study, including more than 4,000 patients admitted after an acute myocardial infarction, cardiac rehabilitation programs were able to increase and improve quality of life of both sedentary and active patients, as you can see in the graphic. However, if we look the graphic in more detail, we can appreciate that the quality of life of sedentary patients after the cardiac rehabilitation program was lower than the ones of the active patients even before performing the cardiac rehabilitation program, which means that we need to incorporate primary prevention strategies rather than secondary prevention strategies. It means that we have to promote a heart healthy lifestyle from the very beginning. For this purpose, technology has a really main role. Despite this evidence, the outreach of cardiac rehabilitation programs, the face-to-face ones, is still quite poor and limited in Europe. Barriers to implementation and participation in face-to-face cardiac rehabilitation programs include the ones derived from the systems, such as scarce derivation, cost, same system for everyone, derived from the patient, such as low motivation, low functional capacity, lack of time incompatibility, derived from practical levels, such as distance to the center, transfer time, money spent in the transfer, but also now we have to take into account COVID-19 pandemic crisis, which first closed all cardiac rehabilitation centers, then we have to open with restrictions, and also we have to take into account patients' anxiety due to the risk of contagious when they have to go to the face-to-face center. Indeed, only 1 to 7 ischemic heart disease patients can access to a CR program in Europe, 1 to 2 in Nordic countries, and 1 to 13 in southern countries such as Spain. In this situation, cardiac telerehabilitation has emerged as a safe and effective alternative to face-to-face programs. The problem is that most of cardiac telerehabilitation studies have been conducted in the same population, a population practically all men with no ancient patients. Also, the exercise intervention is focused only on continuous aerobic training, and they leave aside also the nutritional and emotional support. Indeed, there is a need for more studies that include women, fragile patients, and other exercise training modalities and synergistic interventions to exercise. In this context, it arises our proposal to develop a cardiac telerehabilitation program specifically designed for ischemic heart disease patients. Here I present our objectives, who were to improve aerobic functional capacity, to improve strength, to control cardiovascular risk factors, to increase adherence to treatment, and to improve patients' quality of life. Here I present the table of inclusion and exclusion criteria for our population, and I just want to highlight that our project has no age limit, and we try to be focused on a sex-balanced population. The Telematic cardiac rehabilitation program starts 1 month after the cardiac event, and in the first visit, we perform a maximal exercise test on a treadmill in order to assure that there are not contraindications for exercising, but also to establish a heart rate range within the patient should train. We also assessed and evaluate addition to Mediterranean diet, quality of life, adherence to treatment, and emotional state. This holistic rehabilitation program includes 3 physical training sessions and 1 educational session, and it lasts 8 weeks. At the end of the program, we perform a second visit in which we do again a maximal exercise test in order to prescribe exercise for maintenance, and we also evaluate addition to a heart healthy lifestyle. From December 20 to April 21, we have enrolled 28 patients. 2 abandoned the program due to the lack of technology capabilities, and also they didn't have any familial support. 1 was excluded due to a malignant arrhythmia during the initial effort test. 15 are now doing the program, and 10 have already completed. Prescribed individually, and the exercise training sessions consist of a functional training circuit that combines aerobic and strength training. Health coaching includes nutritional and emotional support, and also a basic cardiopulmonary resuscitation workshop. If for both exercise training sessions and health coaching sessions, not only the patient is involved, but also the family. Here I present our preliminary results from the 10 patients that have completed the program. The CR program showed a high adherence to both exercise training sessions and educational sessions. It improved significantly maximal aerobic capacity, muscle strength, and also weekly training volume. Even if it did not reach statistical significance, we think that this is because we only analyzed 10 patients. It seems, looking at the table, that the cardiac rehabilitation program was effective also in reducing anxiety symptoms, and also improve addition to Mediterranean diet and improve quality of life. At the end of the program, we ask patients if they think they're going to continue exercising after the program. And as you can appreciate in the graphic, half of them were very confident. They consider that they are going to continue exercising, but half of them, they were not so sure. In other words, that means that for 0.5% of our population, there is a need for a maintenance cardiac rehabilitation program. And also for this purpose, technology has a main role. Indeed, what we have to always look for is to establish exercise as a habit.
Okay, thank you, Maria. So now we will explain you more the technological part. So as Maria has explained, here the technology makes an important impact, and how we designed that program was we collect the data from the Fitbit through Bluetooth technology. Then the cloud analyze, process, and encrypt the data to ensure also the data protection of the patients, which is a must. And then, as you can see in the dashboard, the doctors can see like the data from these patients, and also they can be in touch through the communication channels, as for example, the chat and also the video calls. So we adapted during the pandemic last year the solution to this very specific telematic program. So the important information that the doctors needs to collect was set up in this dashboard. So when they have like new visits with their patients, they can have all in one. So they can have in their own dashboard the data that they need to collect, and that they can also gather in a safe way into this platform. Here you can see that there are like some important variables that they need to collect. So doctors can record this data, and it can be saved in the profile of the patients. This is an example also of the training exercise that this like the physiotherapist Raquel is doing with their patients. So here you can see like they are doing a groupal video call, and this has allowed to the patients to do in a virtual way their own visits as if they were in the hospital. And how it works. So it is very easy. So the patients in the application, they have an agenda. In the agenda, they have the meetings that to connect with their own physiotherapist, and then they accept, then they join, and they can have the video call, as you can see here, and it works from the smartphone, tablet, but also they can connect in the website. So we can adapt the technology for the patient's needs and the different smartphone or devices that the patients have. And here you can also track, so doctors can also see the data once they do their visit in a virtual way. So the importance here of the Fitbit, it's because when these patients are doing this exercise, in the same time, they can also share the data with the professionals, and the professionals can see the heart rate from these patients and also the levels of activity. So this helps also not just to have a virtual visit, but also to have a connected health visits, let's say that, during the program of the telerehabilitation. So this Telematic CR program has powered by Ferrer, which is a pharma company that is also entering in the digital health area, and they are doing a lot of work to be close to the patients and the professionals. And for that, we adapted the Human IT Care platform, and we set up a follow-up care plan according to the needs of the doctors. So as you can see in the first screen, the patients have to answer different questions about their own health habits, and also about some questionnaires related to their quality of life. So this data, it is very important as a remote way to do a follow-up, more than the also like wearables. The second, as you can see, they can connect through their application, and they can have an online meeting with their doctors, and also they can have a chat, and in a secure way, they can communicate with their medical team. But most important, that they don't have to use like another tools that maybe are not GDPR compliant, and they can have all in one.
Now I'm going to present the conclusions from the medical perspective. Physical training is an essential therapy for all cardiovascular diseases. Exercise, as I said, is a key part of cardiac rehabilitation, but not the only one. A CR program should include emotional and nutritional support, also interventions to improve adherence to medical treatment and the patient's empowerment. CR programs have proven to improve functional capacity, quality of life, cardiovascular risk factors control, and morbid mortality in ischemic heart disease patients, and therefore are recommended in guidelines with the highest level of evidence. Telematic CR programs seems to be an effective and a safe alternative, but more studies are required that include a wider population, other ET modalities, and an active accompaniment of the patient to confront his or her disease. The advanced program, our program proposes an innovative phase 2 telematic CR program that includes a tailored and a combined ET, aerobic and strength, and the control of cardiovascular risk factors through the empowerment of the patient. Preliminary results suggest that our proposal program is safe and effective to improve functional capacity, muscle strength, and to facilitate the change to a heart-healthy lifestyle. However, phase 3 maintenance programs are required to maintain these initial benefits that we have proven.
In this digital health ecosystem, it's first that this kind of tools can be cost efficient for the system and for the healthcare system. Also that the GDPR has been implemented also in the hospitals, and the commitment of ethics have this knowledge. So that's good because we guarantee the protection and the privacy of the patients. And finally, that we know that the IT hospitals are working on these interoperability systems to include different useful platforms into their own medical health records to provide tools for the better health of these patients. So thank you so much. Here you have the email of the Doctora Maria, and also our email. And if you have any questions, don't hesitate to contact us. Thank you so much.
Thank you so much.